Hello, this is Dr. Robert Bouvier, and this video is about Doctor and You. Specifically, Doctor and You is for patients to help patients' lives live longer, healthier, and prosperous. But specifically, this portion of the video, this is primarily for physicians who are looking to get a little more time and money back to themselves and are contemplating maybe retirement in 10 or 15 years, but not 3 or 4 years. So they're wondering what is the next step for them in the practice of medicine. And you've come here as a physician to learn more about Doctor and You and how it can benefit you as a physician. First off, go to drandyu.com, and there's a button here for businesses, patients, and for physicians only. Click on for physicians only and learn a little bit more about Doctor and You. Specifically, let me give you a little history on how this kind of all evolved for the physician's office. I traveled for many years teaching about hypertension, cholesterol, diabetes, and traveled all over the country and learned a lot about practice of medicine, how other doctors were doing the practice, private practitioners, doctors that worked for hospitals, males, females, just urban areas, rural areas, how it all worked together. It was just an incredible learning experience for me personally, and I brought a lot of that back to my own practice. And I interviewed a lot of my patients after the ACA Accountable Care Act started. I interviewed a lot of my patients and asked them what they were looking for me. What do you want from me? And they came up with a list of things. This was over a 2-year time period, so this wasn't an easy thing, but it was very enlightening for me. And they wanted 24-hour access to me personally, on call. They wanted a very private medical record, and what that meant was, in fact, this was probably one of the most important things to them, was the idea of very private medical record. We were able to do that for them. They wanted same-day on-demand consultation, X-ray lab services, and wellness. They wanted no waiting in the reception area, and it was much time with me as their physician as they needed to take care of their issues. As you know, busy practices, we're seeing 20, 30, sometimes 40 people a day, and it just, it's very difficult. Complex management became very difficult. But with concierge medicine, you're able to take that time with those patients and really devote what is needed to help them live longer, healthier, and prosperous. And then the last part that they wanted was expanded wellness and integrative medicine. Integrative meaning they wanted to know what was going on both in the hospital, out of the hospital, and that transition in between, the so-called transitional care management. They wanted to know my thoughts on acupuncture, chiropractic, homeopathic, naturopathic medicine, and we have a lot of exposure to that right within walking distance of our mall here. We have all of those services, and we've become very accustomed to having an integrated practice to help keep them out of the hospital and emergency department, and number 2, delay the onset of stroke, heart attack, and cancer for 30, 40 years. So a lot of these things were important from a allopathic MD myself, but I found that a lot of my patients were wanting some of these expanded services. When the Accountable Care Act came along, it just kind of made everybody wonder what's going on, not just you as a doctor, but the patients as well. And so we offered this service because, number 1, the employers were spending more money on their on this wonderful health benefit that now has grown from a medical benefit that they could afford to something that they can't afford, and so we had to reel back that cost of that medical benefit. But we showed the businesses how to actually improve the quality of care and improve that medical benefit. We were able to take patients with Doctor and You and give them the time they need. But for me, I needed both. I wanted good quality measures. I wanted my patients to have a good quality medicine, but I was spending more and more time with paperwork and logistics, and it was spending more time with paperwork, rules, and regulations, but less time to improve quality. So Doctor and You has been able to give me the time it takes back, still afford the income that I wanted out of my practice and security that my wife and children needed to live, and it's worked out very well. we're able to give that quality medicine, and for those patients who want something more than just cookbook medicine, and this is not for the patient who says, if my insurance doesn't pay for it, I don't want it. They don't understand about health care. Health care is not the insurance company. Employers understand what Dr. New is all about, and you'll find that about 20 to 40% of your patients will understand what Dr. New is about. Basically, if you look at take on 300 patients that are paying you $1,000 a year, that's $300,000, right? Well, you know, you can have 3-4 times that many patients and make about that same amount of money. You can reel your practice back, cut back on staff, cut back on square footage, go from seeing 20, 30, 40 people a day to 8 to 12 people a day. And you can really do a nice job taking care of that group of people and basically improve your income at the same time. So, if you're looking for more time, more money in your practice, if you're looking at improved quality for your patients, because now you can spend the time it takes to do that, then Dr. New is for you. Then call me about Dr. New. We'll get that. My grandmother would turn over in her grave if she heard me say something like that. But if you want to know more about Dr. New and whether concierge medicine, hybrid practice is for you, then give me a call. Again, this is Robert Bouvier, 810-610-7972, 810-610-7972, or you can go to the website, drandyou.com. Again, this is Dr. Robert Bouvier with Dr. New. Have a great day.